Today's meeting has centered the attention on how to evaluate the risk of cardiovascular diseases, taking advantage of the new information coming from genetics. All the speakers have addressed this point, and the general consensus is we can now leverage on those information by stratifying people according to the risk, both of known risk factors such as lipids, lipoproteins, LDL particularly, as well as taking advantage of the presence of other predisposing genes that are not directly linked to lipids. This will enable us to get rid of the age problem, which inevitably takes us to treat, because of the high risk in 10 years perspective, elderly people with intensive therapy. We will set the stage, therefore, for new activities in how to classify people for their risk at elderly age and how to intervene. The intervention also should be perhaps less intensive than what we need now when we start treating people who already had a vascular disease or an event such as an acute myocardial infarction. My presentation today is going to be on the PCSK9 inhibition, which is the hottest area for lipid lowering, trying to inform people about the results, the relative risk reduction, and who are the patients who will benefit the most for this intervention. Certainly the trials do have some limitations that we all recognize. How to incorporate the data into real practice is an issue, and this is the other topic that I will address in my presentation, taking to the point that we have to leverage on higher levels of LDL in order to be able to achieve the maximum possible benefit for a treatment with such innovative drugs.